Hello, and thank you for joining. Welcome to the AGD webinar Case Acceptance Mastery Preview presented by Eric Vickery, President of Coaching at All-Star Dental Academy. This webinar is a preview of an in-person course occurring in Chicago on March 6th. If you're interested in learning about this topic after watching this preview, sign up for the full course at www.agd.org. Holding a degree in business administration, Eric Vickery brings a strong business and systems approach to his clients. Having managed dental practices for over 10 years, combined with utilizing dental practice management training, Eric has led teams to improving their practices through coaching since 2001. Eric brings verbal skills, systems training, and is engaging in humorous delivery to all of his seminar leading. Eric has been a key contributor to the coaching services programs through the development of his practice monitoring systems. He is coaching dental offices all over the country who benefit from his experience in coaching over 250 dental offices since 2001. Eric, the microphone is yours.
All right. Thanks so much, Kevin. I appreciate it. Well, I'm excited to do this preview of what we're going to be covering on Friday, March 6th in Chicago at AGD. For us at All Star Dental Academy, it's called Team Case Acceptance or Case Acceptance Mastery. Level one is the program. And so I'll give you a bit of what we're going to cover and how it's going to look when we're there for a full day, and it's 8 hours. So to really spend a half hour with you and try to give you some really good nuggets today on how to improve your case acceptance is my goal. And so this isn't going to be like a teaser and, oh, you need to, come to see more. I'm going to give you some really valuable information today and spend about a half hour together and make sure that you feel like when you walk away, you can make a difference in patients' lives. Our goal at All Star Dental Academy is to help our clients help their patients get as healthy as possible, as quick as possible. So my I put this picture up because my wife Abigail, her father is a dentist, and that's how I got in this. I have a business degree, as Kevin mentioned, and I see smiles when I look at a picture of my family. Obviously, as a grandfather now, there's a special place in my heart for that smile. But I want to make sure that everyone understands what this is about. We are not interested in dentistry and being in any sort of pressure sales. We help a lot of clients with helping patients get as healthy as possible, as quick as possible, without pressuring patients, without pressure sales, with having integrity. That's our motto, training with integrity. We help mm, over 100 coaching clients a month live with our virtual coaching in that endeavor to help them with integrity reach that. So I'm going to talk about how to do that today. And of course, I want to introduce you to the future president of coaching at All Star Dental Academy, my grandson, Wells. Wells Vickery is very special to me. So I thought I would share that imagery with you just to give you some insight into who I am as part of All Star Dental Academy. I lead a coaching team of 13 coaches all over North America, and my business partners, Alex and Heather Nottingham, are the founders of All Star Dental Academy, which we can talk about more at the end of the program today. So let's jump in. We know that if you have a really good system, you can have structure for consistent implementation. So we take verbal skills and we put them into a system. Now on the blue along the bottom, this is everything I'm going to cover on March 6th in Chicago. Everything in blue, everything in red to get the patient to say yes. So I'll do a quick overview of this. Our five foundation principles are you have to have a team doing all of it. So we talk about what does it take to have a healthy team, healthy individual to have a healthy team. In the no approval addiction part is the healthy individual section so that we are not fearful of having healthy conversations with patients. We then go into personality and we talk about a system we use as DISC or the Japanese term Harage, and that is understanding and reading your patient and adapting your language and your style to make sure it meets mm, their style, what works for them. We talk about how everyone on the team is a leader and that there needs to be vision and direction for that and get clarity on that. And then we put a verbal skill in place called asking questions, which we're going to talk a lot about today. Then we have the great call process for the new patient phone call. And that is the foundation of All Star Dental Academy. Great call, which is greeting, rapport, engage, ask for the appointment, take the information, your intake form for creating relationship with patients on the phone to help with case acceptance. Our next step in case acceptance is called preheat, which would be not only preparing ourselves for the patient and making sure the clinical team knows what to expect with this patient, but also preheating the patient to make sure they know what to expect when they come in. It's setting us up for success. And then where we're going to be spending some of our time today, about 50% of our time is in discovery and solutions. And there's actually two parts to discovery. One I'm not going to talk about today, which is the preclinical interview, finding the patient's, we call it the why, WHY. Why are they looking to take care of their mouth? Do that first. Seek to understand before being understood. We don't tell a patient what they need. We don't do pressure sales. And then the second part of it, which we'll talk about today, which is the clinical exam and how does the patient discover what's going on with the health of their mouth. And then we'll finish today with solutions. Case presentation formula is a verbal skill that I wrote with a mastermind group back in 2007, and we've constantly improved that over the last, almost 20 years. And then not today, but in Chicago, we'll talk about how to handle objections, how to do effective transfers. We'll even do a stop cancellation section right about here. And it's really about getting patients to commit and keep their appointments. So that's the big system. And Edward Deming said 94% of success is in the system. So we want to have a very effective system that we follow to help patients not only keep their appointments, but not to cancel them. And financial arrangements are up here in commit. And then it goes into ideal day scheduling and things like that with our coaching. All right. So we're going to be focusing today on discovery, and then later you'll see this will turn blue on solutions. So let's just jump right in. We have a half hour. I want to make sure I give you exactly what I intended, which was great value today. So if we're going to be aware that we don't want to be in pressure sales, and yet we are in sales, how do we do that in a really healthy way? I don't like the S word sell. It's a 4-letter S word. It's not something I'm comfortable with. I don't believe that most dental offices are comfortable with it. When I graduated with a business degree, I didn't know I was going to be in dentistry. My father-in-law is a dentist. I fell into it. And what I realized was, even though we say we don't want to sell the patient or pressure sell them, there's a very common phrase that's used in dentistry that is pressure sales, and we're all guilty of using it. I'll raise my hand and say, okay, I fell into the trap too, where I said, you need a crown. And as soon as you tell someone what they need to do, you are now pressuring them into treatment. So we have to realize our job is not to sell treatment. Our job is not to sell crowns, bridges, implants, veneers, 4 quadrants of scaling and root planning. That's not what our job is. Our job is to make sure the patient buys into the condition, the problem, and what's going to happen, the consequences if they don't do anything. And you'll see how we'll lay this out today. So the first rule of sales, healthy sales, that we're going to accomplish today, and it's the only one we're going to accomplish today, even though there are more, is that people don't buy a solution to a problem they don't perceive to have. So how do we do this? Well, we use the clinical exam in the discovery process to make sure we do this well. So if we know that people believe more of what they overhear than what they're told directly, we're going to use the doctor to assistant conversation as our overhear psychology system, where doctors calling things out to the assistant so the patient is hearing it and understanding what's happening. Now, I'm going to lay out systems within systems. We love systems, and it's okay, what is that tool called? So when I say to our clients, hey, we're going to use our overhear psychology, and we're going to scratch out any limiting terms that we've been using. So for example, if I were to listen to you do your exam and you're calling things out to the assistant so the patient can hear it, therefore understand it, therefore buy into a problem, it cannot sound like this. Let's say Shelly is my assistant and Ricky Bobby is my patient. and I'm talking to Shelly, and I say, Shelly, on tooth number 3, there's an MODL amalgam with defective margins and a class 5 on the buccal. We'll do a crown buildup and a crown. Tooth number 4. Now, if I do that, that's pretty common lingo. If I call all that out, maybe I even say crown lengthening, but I say crown buildup, crown lengthening, crown, and all that mumbo jumbo before. I want you to think about it. What is that patient hearing? They are not hearing problems. They're not hearing what the real issue is. What they're hearing is one word. And what is it? Crown. And a crown, when they hear the word crown, what do they think of instantly? Money. And now we are in the sales arena that we don't want to be in. They just heard you tell your assistant over here, psychology, that you, quote, need a crown. And they're wondering why, because they're not feeling any pain. One of my sayings is no pain, no problem, no pay. And when there's somebody saying you need to spend $1,500 to $2,000, but I don't feel anything, they're going to be confused. And then on the phone, your administrative team is going to get things like this when they call for the courtesy call a couple days before the appointment for the crown. The patient's going to say, "Oh, Cheyenne, I'm so glad you called me. I was just getting ready to call you. You know what? That tooth, it's not even bothering me. So I'm going to go ahead and wait." Now, a lot of you who are listening could fill in those blanks. You knew exactly what I was going to say. I knew that when someone said, "Oh, I'm so glad you called me," it was like a kick to the stomach. And the reason for that was they didn't buy into the problem. They didn't understand clinically not only what was happening, but what was going to happen. So we have to make sure our language is clear on the front end during the exam. So here's some systems within a system that we're going to make sure that we use inside of the appointment. All right. So the first one is, well, if we understand that people don't buy a solution to a problem they don't perceive to have, our job is to get them to buy into a problem, to understand the diagnosis and believe that it not only is an issue, but it's not done yet. So the first verbal skill we'll work on, and this is one of our foundation verbal skills. We'll talk about permission statement. Many of you use this. I'm not going to teach it here, just going to lay it out there. Today, I am going to teach 95-5 rule, which is if 100% of our communication is split, 95 of it is split on talking about the problem, which we call the condition, and only 5% of it is focused on solutions. So we get away from saying you need a crown, implant, bridge, scaling root planning. We get away from that, and we get focused in on fractures and deep decay and describing what's happening and what it's leading to. We're going to be inside of educating the patient via conversation between two dental team members instead of telling the patient directly. They like to overhear it. We'll use implication questions where we imply in the 95 what's going to happen if they don't do something. And then we will talk about how to create vivid imagery with our words. I think it's great to have, a camera or a scan that shows these things, of course. We just have to accompany language to it. So when they go home and they talk to their spouse, they can describe it with the story you tell. They can't go home and say, "Well, they showed me this picture and you should have seen it." It's not going to do anything for them. So they got to walk away with a story. So I want to make sure they understand that as well, along with photos, whether it's a digital scan or an intraoral camera or photo. All right. So let's continue on and look at how all this is actually broken down and implemented. So we're going to use overhear psychology so that they have a co-diagnosis with us. And we're going to use, here's the permission statement. I'm not going to teach this. I'm just going to use it. So before the exam, if I'm the doctor, I say, "Ricky Bobby, I want to be able to, I'm going to do an exam and I want to be able to tell you everything I see that would be of importance to you, that would deserve your attention. Is that all right with you?" He's going to say yes. That's why I'm here. That's to overcome my own fear of rejection. Then the part 2 is for the patient's benefit. And I say, "And just so you know, in our office, if we make recommendations, you're never going to feel pressure from us. You're going to feel like it's your decision and that we're here to accompany you in that decision-making process and help you decide how to move forward with any recommendations we may make at a pace that you're comfortable with." Does that sound fair to you? And I love that word fair. Once I do that, then I'm moving into the exam. And I'm going to use the 95-5 rule during this process. This is just an imagery for us to understand why we do what we do. There's a line here, 95/5. Oftentimes, like that first example I used, the patient simply hears a bunch of mumbo jumbo they can't understand, and then all of a sudden, crown, blah, they just hear this word crown or implant or tooth replacement or periodontal therapy, whatever that language is, and they don't understand what it is, and therefore it sounds expensive, and they don't understand why. So our goal is to plant here in the 95% of the discussion. So if I were to replay that language, Shelly's the assistant, Ricky Bobby's the patient. And if I were to do it correctly, I would call out vividly what I'm seeing so that they can walk away with imagery in their mind so that they can actually, they're empowered to explain it to their spouse at home, to someone else. So it would sound like this. Shelly, tooth number 2 has a large old metal filling in it, MODL, and there's defective margins. The filling has separated from the tooth. In fact, it's like a loose puzzle piece in there that's moving around, and it's metal and it's chipping away at the tooth where everywhere it can, where it touches every time he bites down. It's like a wedge in a log, and there's a sledgehammer, a tooth below it, smashing into it, and it's causing the log to split. The tooth is now splitting on the front and back side of the tooth, and there's now decay underneath this old metal filling, and it's burrowing down and eating its way towards the center of the tooth. Foundation full coverage. Tooth number 3. And I'll describe that. Now, there's more to that process, but I wanted to give you some imagery so you can hear what I'm doing. Notice that 95% of my effort is focused on the condition. I haven't done consequences yet. We're going to talk about that in a moment. And I did mention treatment, but not so the patient could really decipher it. You could even say, 2950, 2740, if you want to call out numbers. So they know foundation, or every time we do a crown, we're going to treatment plan a build up and we can go back and take it out if we want. So you decide what that looks like, but foundation full coverage is the language that I use to describe the treatment. And you just come up with codes that work for your team when it comes to the treatment plan part during the exam process, if that's how you do it. If you do it away from the patient, wonderful. Most people are focused on the treatment plan right here and actually scaring the patient away. So do not cross this line and talk about treatment until later, which we will do in solutions. Now, the consequence part is actually really important. So we use implication questions. Questions are a foundation principle for us, and implication questions are an example of those questions that we use. It's just one example. So an implication question is something that you use when you imply something is coming, or you imply something through the question. The most common, most universal implication question is, are you going to eat that? Now, that can mean a lot of things depending on how you say it, but I always joke and say, there's a plate of donuts. I'm asking, are you going to eat all those donuts? Implying that I'd like one. Well, in our world, we're going to imply one of two things. Where is this condition heading? So is it decay or is it gum disease? If it's gum disease, it's heading towards what? What's the consequence of gum disease? The consequence of gum disease is tooth loss. I'm sure you said it. Maybe trickier, I don't know. What's the consequence of decay? Now, somebody on your team might have said root canal. That's treatment, but you're right. It's what we want the patient to think about before the treatment, which, why are we doing a root canal? That's a toothache. So our two consequences are tooth loss or toothache. And that's what we're going to focus on with our implication questions. We're going to imply what's coming through questions of the patient. So as I saw the tooth that's fractured and all of that, I might have said to the patient, has this tooth started to hurt you yet? No, I'm good. Nothing to see here. Move along. Okay. Have you ever had a toothache before? Nope, I'm healthy. Move along. Don't tell me I need anything. Don't find anything today, doc. Okay. Have you ever heard of a root canal? Well, why would you say such scary things? The patient's like, why would you talk about that? And that is your foot in the door to then explain what's happening. So instead of saying, you're going to need a root canal if you don't do anything, That's the because I said so presentation style, where you tell your kids when they say why, you say because I said so, and don't make me pull this car over and give you something to cry about. You know, so you're going to need this. If you don't, that's not where we go. We use questions. So there's a lot of different implication questions. So during an oral cancer screening, you can imply that you guys are thorough. Has anyone ever done this for you before? Okay. You can go into the clinical exam. How long have you had this infection? You could say, do you know anybody who has long teeth or black spaces in between their teeth? Do you know anybody who lost their teeth to gum disease? If you're doing a bite exam, you can use your knuckles and describe how your teeth come together. Have you ever noticed? And then have them put their knuckles together and show them how they're in grooves instead of knuckle to knuckle. And then the one I was just doing, has this fractured tooth started to hurt you yet? These are implication questions that we want to make sure that you're using, and we're documenting them. This is the clinical exam that's happening, and our goal is for the patient to not only buy the condition, but the consequences during the 95-5 process. Now, just on a sidebar, remember the patient has had a great phone call, our great intake form that we use. This is something that we give all of our clients, and it's just focusing on a system for new patient call conversion. I mentioned it before: greeting, rapport, engage, ask for the appointment, and then take the information. And it's the focus for us is it's not a transactional phone call, it's a relational phone call. And that helps us prevent new patient no-shows or cancellations. I'm not teaching on this today. I will teach it on March 6th. The back side of the document has what we call the emotional SWOT, finding the patient's why. I'm also not spending time on this today because of our limited time, but I will teach this in depth on March 6th. And the goal is to find the patient's why. I want to keep my teeth. Why? My grandfather lost her teeth. I want whitening. Why? Because I have a job interview coming up. People aren't buying the solution, they're buying it for their reasons. So the second sales concept or technique that we're going to focus on is people buy for their reasons, not your reasons. In addition to that, people when they're making these emotional reasons, when people buy for their reasons, not your reasons, that reason is typically emotional. People buy with emotion, justify with logic. So we're trying to find what that emotional reason is, if we can connect it to what's going on with their mouth conditionally. You said you don't want to lose your teeth like your grandfather did, and you have gum disease. Let's talk about that. So you'll see how all this is connected as we paint this picture. So if you look at the two parts of the discovery process, our system, before we ever even look in the patient's mouth, we're doing this emotional exam to find the patient's why, and we bridge that with the permission statement verbal skill we use so we can do the clinical exam, which we just briefly talked about, where we are using overhear psychology for co-diagnosis to occur. I use the example in the word picture of the metal wedge in a log that's being split. You can use lots of different things. Sometimes I'll use an apple with a worm inside of an apple. What's happening? That's decay. And there's a core of an apple, and a root canal is like coring the apple. So we have to have language, again, that they can vividly understand, but we want to connect it to their emotional why. We will focus on all of that and putting all that together on March 6th. Now, we've done a really good job thoroughly going tooth by tooth during the exam process with overhear psychology in the second part of discovery phase. The co-diagnosis is happening, and I'm going to confirm that I was a really effective communicator and know that the patient wants to move forward with any plan I may come up with. We'll see if we did a good enough job to make that happen. So when you look at the big system, all of these things in blue are happening at all times. I'm using questions. I'm using the permission statement that comes from here. My team is working with me and asking questions with me. I'm understanding the patient's personality style, so I'm communicating in a way that works for them. It's not always my way. The phone call has happened already, and we're beyond the new patient exam, and now we're either at a consultation or we are just post new patient exam, and we're ready to present. Now, remember, if people are going to buy for their reasons, not your reasons, you've already done an emotional SWOT, an emotional exam before their clinical exam, and you've connected with them. So I'm going to make some assumptions that today that's happened in this example, and we'll say that Ricky Bobby has a grandfather who lost his teeth. We'll do that. Okay. And that's his emotional reason. And then remember, during the second part of discovery, we then focused in on the condition because people don't buy a solution to a problem they don't perceive to have. So not only condition, but we used implication questions to instill knowing what the consequence was. Now, old school style was sit the patient up, point at pictures and say, you need this, you need that, you need this. In their mind, they're not connecting what's happening because they didn't understand what you were diagnosing. Now, what that would be like in the real world for them is with let's say a physician's appointment. You go to your yearly physical and your doctor is wearing the stethoscope and he or she is having you breathe deeply, taking these deep breaths. As you can hear, I have the ends of maybe a sinus thing going on, right? And he's listening and I'm thinking, okay, sinus infection. Okay, that might be what it is. And all of a sudden he says, all right, let's get you scheduled for surgery, stat. Wait a second. What? Why? I'm going to say why. You need to clean your room. Why? Because I said so. This is what we have to get away from in dentistry if we're going to get people to understand what's going on and want to have the appointment. So instead, we're going to make sure that they understand that 95% so that they move forward in the 5% smoothly. So this line right here is a barrier. Do not cross this line too soon. You've got to make sure that your language is built so that you can, I'm going to go back a slide, so that you can know that the patient has been marinating in this language before you ever talk 5%. All right. So we're not going to cross that line until it's time. How does this look? Patient's going to discover and they're going to want the solution and they got buy-in. We know that they're in. The process to do this is using questions. That's a system that we're using. We're using over here psychology, and we're using the 95-5 rule, and we're using implication questions and all those verbal skill tools that we're talking about. So the discovery process is done, and now we're into the solution stage. So there's just a few steps of the case presentation formula that we use. And again, this is something that when I wrote this out back in around 2007 with my mastermind group, a few dentist friends of mine and clients and mentors, we just really said, hey, how does the human brain work when making a decision? Well, people buy for their reasons, not your reasons. Let's start with that. So for Ricky Bobby, it would sound like this. Ricky Bobby, earlier, you shared with me it was really important for you to have peace of mind knowing you're going to save your teeth and not go down the same path as your grandfather did with the tooth loss situation. And so as you heard during the exam, I am really concerned about the infection in your gums. The reason I'm so concerned about it is, as you heard, as we talked about, that's the number one reason people lose their teeth. In fact, it's probably connected to why your grandfather lost his. I mean, possibly that could be how it is. So my question for you is how? How concerned are you with what we discovered today? Now, I'm going to pause for a second. If I could point out key words in each four of these sections, you heard me emphasize them. Important, concern, leads to, how. When I'm presenting something to a patient, I'm always starting with what's important to them. So earlier you said it was really important for you to have peace of mind. I'm concerned about the fractured tooth on the upper right that we pointed out to you during the exam. The reason that's so concerning, as we talked about before, is that decay working its way towards the center of the tooth, like the worm in the apple working its way towards the center of the apple, that core of the apple, once it reaches there, it's going to kill the apple. And the only way to save it is to core that apple, remove the core of the apple. That's a root canal for your tooth. Our goal is to help all of our patients avoid that if possible. It's unnecessary if we can get to it in time. My question for you is, how concerned are you with this? And if they say, yeah, it's not bothering me, great. Well, let's talk about a crown on that tooth. It would not make sense for you to do that. It would not make sense for you to talk about treatment. So that's why it says do not cross this line on the 95/5 rule. You're not allowed to cross this line and talk about treatment unless they say, yeah, I'm really concerned. So if that were to happen, if I pick up from there, I say, how concerned are you with this infection? How concerned are you with stopping this decay from causing you to lose these teeth? Yeah, I'm really concerned. Great. Why don't we talk about a plan and how we can help you save your teeth? Awesome. Here's the plan, 5%. We vividly talk about what we're going to do to save the teeth in a way that's doesn't, we don't go, well, you're going to need 3 crowns. We don't do that. We talk about what it is. At the end of that description, we say, how? How do you feel about this plan? How much sense would it make then to move forward with this plan? All right. How would you feel if we go up front and make sure that we can work out the financial aspect of this so it's comfortable for you financially and so that it works in your schedule? How does that sound to you? We use that word how a lot. The reason we use how is because you get more language. Instead of saying, do you see any good reason why you wouldn't want to get in these leather seats today? No. I got one word. People will lie to you in one word. But if I say how are you feeling about this plan? Well, I'm not really blah, blah, blah. You can go back. You can also give up, but you have the opportunity to go back into language. What we're really trying to do is get this word how into the conversation. If I communicate really well, then this becomes a a testing site for my language. Did I explain it well enough? Hopefully, you don't even get to the test of buy-in. They go, wow, I didn't realize it was so bad. What do I have to do to fix it? And you're off and running. Now, there's a asterisk down here. Don't violate the trust curve. Just don't push the patient beyond where they're ready. If they're not ready to hear treatment, we're not talking about it. Doesn't work. So this language is really easy to understand for our clients. It's a simple system to understand. The question is, can you get to this place? The why is separate in discovery. You found the why during doing something I didn't teach you yet. I'll teach that on March 6th at the AGD headquarters in Chicago. We'll spend a day together and I'll make sure that you understand how to find their why. If you already are doing that, wonderful. Use the word important. You said it was important for you to have a job interview coming up, wedding photos coming up. That was important for you. I'm concerned about the fractured teeth in the back because, like we talked about the wood splitting, the next time those teeth come together, or when at some point they do, and it splits that log, it splits that tooth, that would be horrible to have to deal with on a day that you're going in for a job interview, or once you get the job and then you're calling out sick because of this. I'm really concerned about that. But the question is, how concerned are you with this? Oh, I'm so glad to hear you're concerned. Why don't we talk about a plan? Great, here's the plan. How do you feel about this plan? How much sense would it make to have you talk about moving forward? You want to get language around where they are. Use the word how. Okay. I hope this helps. I hope this makes a lot of sense to you. Usually it feels like a bit of drinking from a fire hydrant at first, but I'm glad we have this in recorded format for you. And I'm glad that we have a full day to spend with you on March 6th. So what's next? Well, your confidence. How comfortable are you? You have to practice this. So we're going to do a full day of case acceptance mastery training in Chicago on March 6th. So if you want more of this, we've got a QR code here that you could literally scan and it'll open up right to the AGD page with Allstar. We've partnered on this event for that Friday, and we would love to have a room full of your team members. Everybody goes to this, whether they're admin, hygiene, assistants, doctors, treatment coordinators, whether you do, family dentistry, whether you do full mouth arch reconstructive, or you do all on four, all on X. It works for everyone from answering the phone all the way through stopping cancellations. That's the systems. Those are the systems we're going to cover that whole day. That's our system. That's what we focus on in this training. So hopefully I've given you enough time to do this. All-Star Dental Academy is an online training platform that is obviously endorsed by great agencies. So you can have 24/7 online training for less than $300 a month. You can have access to incredible hours. You could spend hours and hours and hours learning how to implement the systems and tools that we teach. These are some of the things that are on there. I just put a few things on here, what you're doing. There's even a dental MBA for owners, but it is phone skills, it is scheduling, it is stopping cancellations. There's role play examples in there for you. So we would love for you to become a part of our family. And so if you're interested in that, you can always reach out to us. And we really appreciate you spending just 30 minutes with us today to learn more about this. and I'm just excited about Chicago's event.
Thank you, Eric. This
Yeah,
concludes the educational program of the educational portion of the presentation. We hope to see you in attendance for the full presentation occurring in Chicago on March 6th. You may register for the course at www.agd.org or scan the QR code displayed on your screen. Thank you for attending this webinar. Take care, all.
thank you.